Hello and welcome to YouTube channel HealthQ, the place where our mission is not only to motivate you but help you to move on to the brighter side of the health. I am physiotherapist Meghna Dave, and in today's video let's discuss about ataxia in children. Children who are born with or after birth, if they develop certain condition due to which, if there is problem with balance, if there is problem with incoordination, or if there is problem in control of movement, then the child is likely to have a problem which is called as ataxia. Now, ataxia is not a disease or else a problem in itself, but ataxia is a sign or else a group of signs or symptoms that is seen in an individual or else in a child due to some pathology in the central nervous system. Ataxia are that's why of many different kinds. Whenever there is ataxia, basically the problem is present either in the basal ganglia, which is a structure that is present inside our brain, or else the presence of problem is in cerebellum. Cerebellum is also a structure of, or else it's a part of our brain which is very important part of our balance system. Along with that, sometimes the problem is also present in the cerebral cortex or else the side of the brain. Now, depending on what area of the brain is involved, depending on that only the ataxia symptoms would be seen. Most of the time, whenever the ataxia is due to the problem in the brain, they are usually classified under cerebellar ataxia category. There is one more type of ataxia which is called a sensory ataxia, where the problem is in the spinal cord or else the peripheral nerves. In this type of ataxia, the proprioceptive system is impaired, and thus the ability of the child to sense the stable ground or a stable surface is impaired, due to which these ataxic symptoms are seen. Now, you must be wondering, what are the signs or else common symptoms that a child with ataxia will show? Where some of the important classical signs that a child with ataxia shows are staggering gait, asynergetic movements, dysmetria, nystagmus, intentional tremors, difficulty in forming speech, loss of trunk control, and swaying or shifting of the body towards the affected side. These are the classical signs that a child with cerebral ataxia or sensory ataxia shows. Along with that, there are some involuntary movements or shivering action that could be seen whenever a child is holding an object. Now, what causes these ataxia symptoms? Some of the common causes of ataxia are autoimmune disorder, cerebral palsy, head trauma, hereditary conditions or disorders, tumor, toxic reaction to certain substances and medication, vitamin E, B12 deficiency, thiamine deficiency, presence of tumor in brain, or else you can say abnormal cluster of cells being present in brain, and stroke. So there are multiple reasons due to which a person can experience ataxia, and that's why the ataxia's symptoms vary from individual to individual depending on what area of brain is affected or spinal cord is affected and what is the cause behind it. So when you ask this question, what is the treatment of this ataxia? Absolutely, the treatment of ataxia depends on what is the cause at first place, and second, what is the type of ataxia. Well, if we broadly look, the ataxia management is a combination, or else you can say it's a multidisciplinary approach where medical management, surgical management, rehabilitative management like physiotherapy, occupational therapy, speech therapy, orthotics, and other areas are used in combination. Hence, whenever there are some symptoms of distress, medical management is helpful. For deficiency management, you need certain supplementation. To maintain the proper nutrition and development of body, nutritional improvement is required. At the same time, to maintain the mobility of the body in the right pattern, to teach child the right movement ways, physiotherapy is important. And that's why cerebellar ataxia management is a combination approach where different rehabilitative approaches as well as medical methods are combined to achieve the goals that are set for the child. These goals are many times short-term, mid-term as well as long-term goal depending on the signs, symptoms and cause of ataxia. Through this video, our attempt was to make you understand what are ataxias in children. I hope you found this video helpful. If yes, make sure to like this video, share this video with your friends and family members or whoever you believe this video would be of help. And we will see you in another video. Thank you.